You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, small improvements to your smile can make a big difference in not only how you feel about yourself, but how people react to you. With us, we have an expert on the topic, Dr. Singh. Dr. Singh, welcome to the program.
Thank you. Good to be here, Randy.
Pleasure. Now, for people that don't know you, tell me a little bit about your practice. Who's kind of the typical patients? What are the different services you offer?
Randy, we practice in West Palm Beach, Florida, and our practice is unique and yet very cozy.
Cozy?
Yeah, it is, because Randy, we have patients who've been coming to our practice for 30 years. Okay. And we've seen their families, we've seen their children, now we see their grandchildren, and the patients who just started with us 5 years ago plan to be with us for another 30, 40 years.
So I think you told me that your average patient is, in their 70s.
Yes, that's right. Well, 70s is the new 50s now, Randy, isn't it?
Yes, yes.
So, yes, our typical patients, we cater to a lot of retired patients, especially patients who are living in these retirement communities. It just started like a snowball effect.
80% all go to you.
Yes.
And they sit in your waiting room. They carpool
They carpool, yes, they
really?
do. They sit in their waiting room and they talk about their, they bring their dogs sometime, and it's phenomenal. It's like a family environment. And it's just the snowball effect. We started with one patient and then go on to the other, and they meet in the clubs and they talk about us while they're playing golf on the golf course. We are very blessed. We are very thankful. They're very nice patients. And the reason I think it all started was we started seeing some retired dentists.
Okay.
And all the people who live in the community, who better to ask to which dentist to go to than somebody who's been a dentist. So that's how they started with us, and they love us, and we love them.
So you do everything from dental implants, cosmetic dentistry,
yes,
gum disease treatment,
absolutely,
smile makeover, veneers,
you name it,
Invisalign.
You name it. We do something as simple as cleanings and fillings, and we do smile makeovers, we do complex cases, full mouth implants, IV sedation cases where patients are phobic or they want to just get it over with in one sitting. We do Invisalign, all kinds of cosmetic dentistry, extractions, not the fun procedures, but we do it all. And the most emphasis we lay on is cosmetic dentistry, implants, and Invisalign in our office. Now,
you brought a lot of photos. And for anybody watching this, the photos you brought are dramatic. That means, when I think of Invisalign, I think of, but these are dramatic cases with just Invisalign.
Yes.
But let's talk a little bit about your background. I mean, you have, American Academy of Cosmetic Dentistry. Not a lot of people with that. Went to UCLA, in dental school, top of your class.
Yes.
You always wanted to be a dentist?
I always wanted to be a dentist. I wanted to be a dentist when I was a little child, Randy.
Really?
Yes. My grandma, back in those days, they had fake teeth. And my grandma used to look so beautiful, Randy. And I used to call this a miracle thing. And every time I saw her at night without that, I was scared. But in the morning, I saw her with that miracle thing on, and I thought she went through some beauty thing at night. And it was just, it totally changed her. She looked so beautiful. And I knew, I used to tell her, Grandma, when I get older, I'm going to make all the grandmas beautiful. I'm going to make them gorgeous.
Right?
I'm going to make them even prettier, because she loved me. And, I assumed all the grandmas loved their grandchildren.
So you were meant to do this. But people don't like going to the dentist. I mean, as friendly as you are. I mean, you must hear still, right?
Yes.
No offense?
Yes, we do. But I had a patient 2 days ago, Randy, here, and she goes to me, well, I love coming to the dentist. I'm like, oh, that's a refresher. How come? She's like, who else at my age of 55 is going to make me look younger and beautiful without doing major surgery? She had a point.
Yeah, well, you think the teeth are pretty important. Oh. But obviously you're a dentist, so you think it's important.
Well, I notice teeth all the time as a dentist, but I noticed it even before when I was a dentist. Randy, there's so many facts out there that how we judge people by their teeth. It's not just what I think it's a fact. It's a reality. You look at all the surveys. There's so many. I can name endless surveys there. There's survey, Muscle and Fitness magazine. You would think, body would be...
Like what do you look for or find attractive?
Again, in the opposite sex. And you would think, body would come as number one, right?
Physique, yeah.
No, it's smile. It's smile.
Interesting.
It's number one.
I guess that is true. They always say the smile,
Yes.
You know, the eyes, etc.
Yes, American Academy of Cosmetic Dentistry. They did a survey and they said the number one thing you remember from your date is their smile.
Is that right?
Yes.
Are there a lot of people, though, that don't like their smile?
Oh, yes. I see it all the time, Randy. And it's heartbreaking because they always want to cover it. I have a story of somebody in my own family, you know, my brother-in-law.
Okay.
He used to hide his smile all the time. When we got married, he was about 19, and none of the pictures he was smiling. And I go to him, AJ, why aren't you smiling? You only have one brother. Aren't you happy for us? He's like, don't get me wrong, but I don't want to show my teeth. And he is such a joyous person. He's full of sense of humor. If you talk to him in a family environment, you'll know, but when you see him outside interacting in a social environment, he's not comfortable. He would never smile. He's a totally different person.
So you fix his teeth and then what happens?
Well, he's a totally different person now. He's always sharing the joy of laughter with his friends, with his colleagues. He's a successful businessman. He's engaged to be married to a beautiful, lovely person. He smiles all the time. And he says, I want to smile because I want people watching my teeth. I want them to show that I made a change. His big thing was he didn't want metal in his mouth. All his life, he didn't do anything. He said, my parents should have done that when I was 12 and 13. But they never did it, and I'm not going to put metal. I'm a 19-year-old. They're going to, you know, always bully me about doing braces at this late stage in my life. So I'm going to do something when it is invisible. And hence, when I joined the family and I started believing in it, I did it on myself, and that's when
Invisalign. We're talking about Invisalign.
Yes, I did Invisalign on.
Okay, so today we're talking, because there's a lot of ways, I guess, of cosmetic dentistry, but
Absolutely.
I invited on the show today to talk specifically about Invisalign, because you say you can make big changes.
Oh, yes.
You are a major provider of
Yes.
Invisalign. I guess there's different rankings.
Yes.
What do you call?
Randy, there's 3 rankings. Actually, there would be 4. A general Invisalign provider, a preferred provider, a premier provider, and an elite provider.
And you're a premier provider.
I'm a premier provider, and I'm very proud of it. And it's something that the recognition we get from the Invisalign themselves, based on the number of cases and the experience and how well we do it, they provide this recognition to us.
So it doesn't cost more than to go to somebody with a lot of experience?
Oh, no. Regular fee for Invisalign is about based on the local, market. Everybody pretty much charges
so it's about
the same amount.
Place wherever you go.
Yes, but there are a lot of people who advertise for less cost, though, because what they do is they don't tell the patients, and patients don't know that. There's also different types of Invisalign programs. There's regular Invisalign, which means you treat the case until the teeth are perfect.
Yeah.
And you go on and on and on. Not that you have to, but there's also called Invisalign Express, which is Invisalign with only 5 aligners, or Invisalign Express with Invisalign only 10 aligners. So at the end of 10 aligners, your teeth are the way they are, and that's it, you're done.
They might just be a little bit straighter.
Yeah, they might be a little bit straighter, but they're not going to be perfect.
Interesting about advertising. Okay.
Yes.
But you offer all those things as well.
Yes, we do.
So does experience matter? And this seems like an obvious one, but I frankly think it seems like the trays do all the work.
Yeah, no, it's not true.
Okay.
Trays do a lot of work, but once I submit a case, I take the patient's photos and I take the patient's impressions and I submit it. And what is on my computer is their software called ClinCheck.
Okay.
And on the ClinCheck, what they do is they tell me this is what the case is going to look like at the end, and this is how long it's going to take. And I can see their before and after before I even start the case. But you have to have an eye to see whether it is right or not. You can not have an eye and just approve it and let them decide what they want. But another thing that's very important, Randy, is that a lot of times patients just self-diagnose themselves and they say, oh my God, my gums are so bad, I can't even do Invisalign.
But isn't it true if you have bad gums, though?
Yeah,
tough to do.
But we are a comprehensive practice.
Okay.
And we can clean up their gums right away. When you talk to Dr. Roberts, you'll know what an important and...
Yeah, he's going to be on the show.
Yes.
Your partner,
yes,
to
absolutely.
talk about wiping out gum disease.
Absolutely. So we wipe out their gum disease because you don't want to move teeth.
Without surgery, too.
Absolutely.
Okay.
You'll find out more about that. But if you have gum disease, you don't want to move teeth because you cannot control the forces. So absolutely, we wipe out their gum disease. And a lot of patients think that just doing Invisalign is going to solve their problem. No. Sometimes we have to employ a combination of techniques, like might have to add a veneer here and there, which I'll show you in my pictures. And sometimes add an implant, which I've done in a lot of combination cases. So you want to go to a place where they can provide you all these services and not have to go from a doctor to a doctor, and then there's loss of communication, and it's never right.
So, you know, expressions like, and we've talked on the phone, like change your smile, change your life. Do you believe you're changing people's lives?
Absolutely, all the time, all the time. I have a lot of pictures to show you.
Okay, let's start with those.
Let me show you this one. Now, when you look at her, Randy, she's a gorgeous woman. She's in her 50s, but that's her full smile.
She's smiling.
She's smiling there. And what do you think when you see her? She's smiling. You think maybe she's
not showing her teeth.
Yeah, but this is her showing the teeth picture. She wouldn't smile. She would not smile. She's not proud of her smile, so she wouldn't show her teeth. But when you look at somebody like that, you think they're not happy people. They're not happy people.
So there's a lot of people like this walking around.
Yes, they hide
and
their.
They're not mad or.
Yeah, and if you're in a dating scene, Randy, when you see somebody like that, you'll say, oh, maybe she's not friendly. She doesn't want to go out. Too serious. She doesn't want to go out or anything like that. But let's take a look why she doesn't like that smile. What's underneath that smile? Look at the crowding on the bottom teeth, Randy.
So on the bottom teeth, that's the bottom.
Yes,
oh, boy.
This is a phenomenon called midline migration, where after a certain age, as we age, our teeth tend to shift.
Yeah, the lower seem to shift.
Yes, they start to get crowded. And the reason being, you know, the lower teeth in the mouth have the smallest roots, so they tend to shift very fast. So that was the reason behind not smiling. And what could you do to treat? What are her options to make that smile pretty where she'd be actually smiling? You could do veneers for her, and you could do a whole other kind of cases, recontouring, bondings, and things like that. But veneers is very expensive, and it's not a reversible procedure, which is what I love the best about Invisalign. It's very conservative. You're not taking away anything from your teeth. You still have what nature gave you, but you're just putting them in the right place.
All right.
So if I do veneers for her, I'm taking away her enamel. Her teeth are perfectly beautiful. I don't need to take away any enamel. And it's going to cost her, with a good cosmetic dentist, anywhere between $20,000 to $50,000 to do a veneer. And they do not last a lifetime.
So when you meet her, is it in your head you're going, boy, Invisalign's going to be good for her?
Oh, yeah.
Okay.
I get excited about it because I know what they're thinking in their mind is veneers, and they're thinking, oh my God, you know, I have to go through that procedure, which I love doing veneers. I'm a cosmetic dentist. But
it's more. It's a lot more.
It's a lot more, and there's a place for every procedure, I believe. And
let's take a look at that after.
And look at her teeth.
Is that her?
That's her.
Very nice.
Can you believe that? What a transformation. Now, look at the before and after, Randy. Think of your impression about the person.
Yeah.
Look how she's smiling, enjoying her life. You think she's outgoing, she's a happy person.
Yeah.
She's more friendlier. She's enjoying her life. So the total transformation happens in lives, is what I believe. But when I ask her how happy she is, she's like, I can't tell you how happy I am, but I have one regret. And I go to her, what's your regret? She's like, I think I should have done this years ago. I cannot bring those years back when I didn't smile. And you know,
so most people that do this, they've hated their smile for a long time?
Oh, many years. They wait all these years. When something as simple and painless and quick can make such a big difference, why would you wait all these years? You can't bring your 40s back. You can you?
No,
can you?
You can't.
No, then do it. You know you have to do it. Why wait longer and make it more complex?
Why in this economy invest in your smile? Or in any economy?
If you're looking for a job, Randy, you want to interview 2 people for a job, they have same credentials, right? Who are you going to pick? The one who has a beautiful smile, a pleasant personality, or are you going to pick somebody who's with the same credentials but not smiling?
Yeah.
Is serious looking like that? Who are you going to pick?
That's true. I mean, you hire the happier person, for sure.
Absolutely. Absolutely. It's all about customer service. And if the person who you're hiring is not happy, is not going to be able to deliver the customer service. I went to the hair place today for the show to get my hair done. And I was shaky and nervous. The minute I entered, she treated me with a smile. And I was confident right away. I'm in the right place.
Is that right?
She's going to be good. Yes.
Okay, good.
Yes.
Good. Okay, you brought more photos.
Oh, absolutely. This is my brother-in-law. I told you his story a little bit earlier, remember?
A little bit.
Yes. But how many guys you see these days? This is his smile picture. He was so conscious of his smile.
Like even at a dental office, you can't get them to smile and show their teeth?
No, I could giggle him and do anything.
Okay.
He wouldn't smile. So much so that I got these pictures from Invisalign, Randy, because he came to my house and deleted the pictures from the computer because he didn't want anybody to see this.
Right?
This is my brother-in-law.
Okay.
So he had access to my computer, and I'm looking for the pictures, and I can't find them. So I had to call Invisalign from the record submission to bring me the pictures.
Okay.
But this is a smile. And Randy, it's not just him. I see a lot of young guys walking around and not smiling.
You see it as a dentist.
I do see it all the time. Either it's like the hand comes right away if they're smiling, or they would just keep their mouth like this. But take a close look quickly,
right.
Randy. Look at his upper teeth. See how they are flaring?
A little bit, okay.
Yeah, the front teeth are flared out like this. And you know, people can get into accidents and actually break them. And look at his bottom teeth, Randy. They're so crooked. And you know, when you're talking, you show your bottom teeth. You think
especially when you're 40 plus.
Oh yes, a lot of patients think that, you know, we only show our upper teeth when you're talking and smiling, but that's not true. As we age, the gravity pull, the muscles of the lips, they get relaxed, and when you're talking, you actually see. You can compare some of the pictures. You see older person when they're talking or smiling, they show the bottom teeth. And
so with him, Invisalign,
he didn't want to put metal in his mouth, as I told you.
Okay.
And he did it after I did Invisalign. Now he's a handsome-looking young man, but look at the difference. I mean, I can't say enough words. I mean, pictures are doing the justice. And if you see him in person, you would see his personality. He's always joking, always fun. He's a very successful businessman now, and he says a lot of it, I give credit to what I did in my life. He says that's the best thing I did in my life.
Really?
Yes, and he says not only that, because I started taking care of my teeth, I now take care of the rest of my body. I work out, I eat right, I've taken care of my whole body. It's just a discipline that I got from Invisalign, and he thinks that was the best decision of his life. And I agree with him.
I've met some of the doctors, plastic surgeons from that show, Extreme Makeover, and they say that the teeth made the biggest difference.
Yes.
And if you've ever seen the show, it's true. And I'm not trying to side with you. People need to know it's a real interview.
Oh,
I'm just asking the questions. But I guess, it proves that it does make a big difference.
Randy, Halloween costume. If you want to be a vampire, or you want to look like a scary person, what's the most important component?
That's right. I guess you make the teeth crooked.
You make the teeth. You make the teeth crooked. You make like vampire teeth.
How old can you be? Could you be 50, 60, 70 and still get Invisalign for crooked teeth?
I have patients who are in their 80s. Not just
getting
one.
Invisalign.
Not just one, but multiple. People are dating at this age these days.
That's young, especially in Florida,
I have patients.
Right?
Oh yes, it's a retirement community, most of it. And we have patients I have patients who are 100 years old.
Not with Invisalign.
Not with Invisalign.
Okay. But they come in and they care about their teeth.
But they come in and they care about. I have patients who still have all their teeth at the age of 100, and it's because they took care of their teeth.
So somebody in their 70s and 80s, and we know that's young today.
Yes.
When it's all done and they look in the mirror, what do they say?
They love their smile, and they say, "Oh, I wish I had done it sooner."
Okay, good. Now we're almost out of time, and I know you brought a few more photos.
This is my patient Linda.
All right.
And that's her best smile.
Now, did you tell them to do this because you were coming on my show?
No.
They're smiling with their mouths closed.
Randy, I was really struggling when you asked me to bring some befores and afters, because Randy, our practice is a word of mouth practice. Really.
Yeah.
We are just recently coming up with our website. I mean, we live in the old world. Yes.
Okay.
We have every advancement when it comes to technology in the office, but we are not advertising kind of people.
So this woman is smiling. She's obviously very self-conscious of her smile.
Absolutely.
And underneath that is...
You can see the reason. You can see the crooked teeth right here. You can see the crooked teeth. You can see how this is starting to chip her teeth. Okay. And that chipping can later on lead to tooth loss. Now, Randy, I could put veneers on her and make her teeth look good. But if your teeth are good, you have the right teeth, why not just move them and make them look like veneers? Now look at her smile. Tell me they don't look like veneers.
They do look like veneers.
And she hasn't even done whitening yet. This was her appointment. The biggest thing with this was I didn't have to convince her to do Invisalign. It was her husband. He always said, "Oh, plastic cannot move teeth." And I had to sit down and do convincing. And when you can see his hand over her shoulder, I cropped him out.
So the husband says you need regular braces.
Yes. Your teeth are so crooked, the plastic is not going to do it. And she wouldn't put metal.
So he didn't believe you?
He did not believe me. And now put the before and after side by side. You can even see. And
she looks like a different person.
Oh, she does. And she's smiling away. Her confidence, oh my God, the self-esteem and boost of confidence she has now is unbelievable. And now he is going to do Invisalign.
Oh, he is?
Yes.
Okay.
I have many patients whose husband or the wife will start and one will do it and the other one, because 70 to 80% of the patients have crowded teeth. Yeah. And a lot of these teeth can be simply treated with Invisalign. We don't always have to do veneers. And don't get me wrong, I love doing veneers. We don't always have to. We can do combination of cases. Like
okay, good.
This one example. I combined his case with Invisalign. He had a missing tooth and a veneer. Now, he wasn't very conscious of his smile, but look at his teeth.
Yeah,
his teeth are shifted. We call it canted. You can see how small this tooth is. And he had actually come to me because he had fractured a tooth chewing on ice.
So when your teeth are crooked,
yes,
they like hit,
yes,
and then they chip or whatever.
That's called traumatic force, because when they're crooked, they're not. The forces should be directed along 90 degrees. I don't want to get into technical stuff with you, Randy, but that's how he chipped his tooth.
So you're
perfectly
thinking
healthy
Invisalign.
Tooth. He lost the tooth. So no, I didn't even think about Invisalign for him. He said to me when he came in the first day, he goes to me, well, this is my fractured tooth, but now that I'm going to do it, I've been waiting all these years, I'm going to do it all right. So fix my smile.
Okay.
And then my treatment diagnosis was, okay, he's lost that tooth, he's too young to get a bridge or anything, so an implant for him. This little guy is too little, no matter how straight I get it, I'm never going to be able to make it look good. So one veneer there, and look at his smile now.
Wow.
Now look at the before and look at the after, Randy.
Yeah.
I mean, what do you think of him? What is your judgment of him?
Well, in the after, it's interesting because you have, he almost looks college educated.
Absolutely, he does.
And before, he just looked like a really nice guy.
Yes.
Right?
Yes.
But now it's like sophisticated.
Yes, and look at, I'm going to take you to the technical side again.
The corners of his mouth.
Look at the corners of his mouth. See how they dark?
Oh, interesting. Didn't even notice that.
Yeah, and it's not veneers that I added on something and made them come out. It's just expanding the arch with Invisalign. A lot of people think Invisalign can just do a little bit movement here and there. No, you can do anything.
So that's what makes up a good smile, a broad
smile that follows the lip line.
Interesting.
Yeah, matching the whites of the eyes and all the other things.
Time for two more, because we literally have less than a minute and a half left.
Okay, all right.
Great stuff.
This is my lab technician.
Okay.
And he's been working with Dr. Roberts for over 20 years. His name is Gilbert. I call him Mr. Gilbert.
Okay.
And this person has been married to a beautiful woman. Her name is Lisa. And she told me once she came to the office, they've been married for 25 years. She's like, I've never had the heart to tell him this, but I don't like his front teeth.
Okay.
Look at that. When he bites down, his teeth are completely covering. The front teeth are completely covering the bottom teeth. Mm-hmm. And you can see the other two teeth are kind of overlapping. And he was phobic. He thought, it's going to be, even though he's in a dental office, he's a phobic patient. He said,
interesting.
He said, it's going to be painful. I don't want to do braces. I don't want to tweak those wires. I heard it hurts and all that stuff. But I talked him into it. I said, it's going to be real painless. Let's do it. And I took his impressions, and all he has to wear is like bleaching trays.
Looks
and
good.
And it's look at the after.
Very
and
nice.
Lisa is in love with him all over again.
His wife that made him do it.
Yes.
You have a tight relationship with your patients. You said that they don't even, because at the beginning of the show I said, what should I call you? What do your patients call you? I'm calling you Dr. Singh, but they call you by your first name.
Oh, they call me Daman. Some of them call me Dee.
So there's no doctor. I mean, they just say you're...
No, there are families. We get up every morning to go to work and spend 8 to 10 hours with them every day. So it's family. You spend less time at home. You spend more time with them.
Okay.
One last one, please.
All right.
All right. Now this one, she's my star patient. She is my role model. Now she lives in one of those communities I was talking about. She lives in Ibis. And she was never conscious of her smile. She's been a patient for a long time.
So she was fine with her smile?
She was fine with her smile. But you can see how this tooth is totally turned almost 90 degrees. You can see the bottom teeth, how crooked they are. But I think she didn't know what her options were, or maybe she didn't know that something as simple as Invisalign can fix. She probably thought that she will have to lose all her teeth and she would wait until she can carry on with them. But she's still in treatment, but look at her. She's training all the time to smile. She has
Very nice.
She but she looks so many years younger. The other day she came to me, she goes to me, my husband tells me, you must know something that I don't know. I'm like, what is that? She's like, well, he says, you lost weight, you got your hair straight, you got your teeth straight, you're a totally different person. What is it going on? I don't know. Maybe you know something. And she is in that community. I've gotten so many referrals because of her. Everybody wants to come and make that transformation.
So you have about 80% of those communities, right?
Yes.
So the 20%, and we're out of time. I want to thank you so much for coming on. We're talking about Invisalign. The people that are walking around out there that don't like their smile, the 40-year-olds, the 35-year-olds, the younger patients, the older patients, what's your message to them? Final message.
Don't wait too long to smile. Smile's a beautiful thing, and it is a window to our soul, and it can be enhanced beautifully. There's no reason to wait. It's painless, it's easy, it's faster these days. People won't even notice it, and you will be able, if you're a singer, you'll be able to take it out and still smile and talk and sing. That's how simple Invisalign is. And I can do anything to make you smile because I love smiling.
I want to thank you for coming on the show. Very good, very nice.
It was a pleasure being here, Randy.
So if people want to make an appointment, free consultation, know your options.
Absolutely.
And you're never too old, and you're never too old for Invisalign.
Never too old for Invisalign or any kind of cosmetic dentistry.
And you say when it's all done, people will walk up to them?
Yes, and they will tell them, yes. Esther, they walk up to her and they tell her all the time, oh my God, you look so good. Oh my God, your teeth look so beautiful. And other people from her community come and they thank me for making a difference in her life. So it's not just her coming and saying thanking me. It's everybody else. So everybody notices it and judges it. If you want to have a beautiful smile, it's never too late. You're not too old, and don't wait too long, because I can do it.
All right.
And I can make you look pretty and give you a gorgeous smile.
All right.
And I love doing it.
Thanks again.
Thank you.
Love your enthusiasm. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com and just put in Invisalign or Dr. Singh. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.